Nationally, there's over 300,000 hip fractures a year. In the Northern Delaware Christiana Care Health System, we manage over 400. The program itself, we've coined the term Hip Fit, which stands for Hip Fracture Intervention Team. And our goal with our Hip Fit team is to get the hip fracture taken care of quickly and safely. That's number one. Number two, we want to get the person back to their prior level of activity. And number three, we want to prevent any future fracture by getting that patient properly managed from a medical standpoint after they get back to their level of activity.
As far as measuring a patient's risk for fracture, there are certain recognized risk factors, but one of the most important measurements is a measurement of their bone density with an instrument called a DEXA machine. And what that does is that it takes a very low dose X-ray picture of the spine and both hips, and is able to calculate the amount of mineral content in the bone. It's a simple test, it's painless, there are no needles or anything, and the amount of radiation exposure is extremely low. But what that does is that gives a numerical value and is actually the recognized diagnostic tool by the National Osteoporosis Foundation to use to evaluate patients and determine whether they're at risk.
You want your score to be greater than a -1 to be normal.
Well, from a fragility fracture standpoint, half of women will have a osteoporosis-related fracture in their lifetime, but 25% of men do also. So it is a little surprising, the breadth of the population that can be affected by this issue.
I'm the nurse practitioner for the Department of Orthopedics, and it's going to be my role to be the fragility fracture coordinator in Christiana Hospital. One of the roles will be to educate the patient and the family members about osteoporosis. Also, actually communicating with the primary care physician. We'll be sending notification that the patient has experienced a fragility fracture, of what bone, what surgical intervention was done, and what our recommendations are. With the fragility fracture coordinator role, I do think that the level of care will be improved.
We are very optimistic about this because the measures that have to be taken really are not that complicated. It's just a matter of making sure that patients get appropriately followed up, go through the system, get evaluated, and then the information communicated back to their primary care physicians so that they can, treat them appropriately.
We're going to impact the numbers. We're going to decrease the number of hip fractures in this community over the next 5 to 10 years. No doubt about it.